You see the parent of a 3-year-old girl who's been brought to the emergency department because she has chest tightness, wheezing, and difficulty breathing. You are assessing her in triage and have just taken her vital signs. The child is not present for the discussion. Hi, my name is Sakura. I'm the nurse at this children's hospital. Are you Mary's mother? Yes, I am. And may I ask your name? My name is Jane. Wonderful. And is it okay for me to address you as Jane? Yes, that's fine. Great. So I just saw your daughter in triage and I just finished assessing her vital signs. I want to ask a little bit more about her symptoms. Is that okay? Yeah, that's fine. Okay. So can you first share with me what sort of symptoms has she been experiencing before she's been brought here? Yes, well, my daughter had wheezing and difficulty breathing for about an hour. Okay, so she has some difficulty breathing for about an hour. And is there any possible triggers that you can think of? Yeah, well, she was running around in the garden when she started having difficulty breathing. Okay, I see. And has it gotten better or worse? Well, the symptoms are less severe now compared to when it first started. Okay, I see. And have you given her any treatment? No, I haven't given her any medicine because I wasn't too sure what to give her. Yeah, of course. And lastly, has this happened before? Well, no, this is the first time. Like nothing like this has happened before. I see. If it's the first time, it must be quite scary for both you and your daughter. Now, I want to ask a little bit more before we talk about the examination findings. So, how is her general health? Well, she's generally healthy. And okay, I see. And has she been ill recently? No, she hasn't been ill recently at all. Okay. And does she take any medication? No, she isn't taking any medication. Okay. Thank you for that. And does she have any family history of asthma, hay fever, or eczema? Well, my partner had asthma as a child, but I don't think anyone else in my family had asthma or hay fever or eczema, in fact. Okay, I see. Thank you for all of that information. It's really helpful. Now, I'd like to move on to talking about the examination findings. So the good thing is that her condition is very stable at the moment. All the vital signs are normal. She does have a mild wheeze, but it's not a cause of huge concern at the moment. So she's very stable at the moment, which is excellent. Now, the next step is that she'll be assessed by the doctor, and the doctor might run some tests or further investigations, and the doctor will give an initial diagnosis and discuss the treatment as well. Do you have any questions or concerns? Yeah, well, I just want to know if my daughter has asthma because I'm pretty sure she has asthma because of her symptoms, and my partner had it as a child as well. That's a great question. However, it's not my role to, give you a diagnosis. I can say that the symptoms are consistent with asthma, but it is the doctor that will make the final diagnosis. And I also want to add that asthma is difficult to diagnose at a young age and in early stages as well. Do you have any other questions or concerns? Yes, well, I really hope I don't need to wait too long for my daughter to see a doctor. Yes, of course. So the waiting time, is not too bad at the moment. There's lots of doctors available, and she will likely be seen soon. It'll be a quick exam and perhaps, starting a treatment with a salbutamol inhaler. Are you happy to return to the waiting room and wait for the doctor to call you? Yeah, I'm happy to wait in the waiting room. Great, thank you so much. Again, if you have any questions or concerns, please let me know. Do you need me to go over anything again in more detail? No, I'm fine, thank you. Great. So we'll see you soon. Bye.